Good afternoon and welcome. It is the 3:34 on a Wednesday. It's the Joel Natale Show on Talk Erie, and we're live from our Kingdom Financial Group studio here. We're introducing a new segment here, and it is a monthly conversation with friends from Hilling-Pfeffer Insurance Agency. And I'm glad to welcome with us here in studio Emily Williams and Sadie Prescott. They are licensed Medicare agents right here in Erie with Hilling-Pfeffer Insurance Agency. Ladies, thanks so much for being with us. I really appreciate it here. Let's say hello, and let's start with you, Emily. Get an origin story. Tell us how you came up and how you got involved in as a licensed agent here.
Well, if you want the origin story, I mean, this is my mother that I work with.
Okay, so she has the real origin story
she's
there.
Got the true one.
Okay.
What was it? I think it was COVID. After COVID, I had made the jump to join her at Aflac at the time. She had been an agent for a little bit. I joined her team in there, and that's just kind of where we found our passion in helping people. Mm-hmm. It seems like...
Had you done some insurance work before? Or?
I had been a contract employee at Erie Insurance, but nothing super into it before.
Yeah.
But, I mean, working with my mother is proven to be a lot of fun and very helpful, because sometimes I swear we share the same brain because I can finish her sentences.
Right. And that evolved into working in selling and helping folks with Medicare. How did that go for you?
We made a relationship with Alan Hilling, family friend, and then we kind of came back, approached him as insurance agents, built a relationship with Aflac. And then he had a Medicare side of it and kind of found a home. And once you are in the insurance industry, yes, each facet of it is very different, but you can kind of translate some things. It's no different than like trigonometry and calculus. Once you kind of have the basic understanding of math, you can figure just about any of it out. Or at least then you know who to contact or who to get a hold of, whether it be the federal government, the state government, or the carriers.
Sure. Sadie, how about you? What got you into this field eventually?
The Medicare side of things honestly started with my mom. She turned 65 and came to me because at that point I had been doing accident and health insurance, and she said that she didn't understand it. And I had no idea. I tried to look into it for her and was like, well, we'll try and find you someone. And she got placed in the wrong plan and had some issues. And I said, this isn't right. If this is the stuff that's going on and it's happening to my own mother, we need to try and fix it and have people out there that are doing it and making sure you're getting the right plans and that you have the correct coverage. So really it started with my mom. So there's your third generation.
There you go. Wow.
And that's really, then we came back, as Emily stated, working with Alan and turning around and having the Hilling-Pfeffer name behind the Medicare as well has been phenomenal. But being able to, start with my own mother and say, this is what you really, need, and reviewing her plan every year to make sure it fits her needs. And that's what, is keeping us going, is because there's more and more people, and we receive those same type of phone calls all the time.
Yeah, I mean, it's important for you guys to share that you're local and independent, and so you're not aligned with any particular line. You're able to kind of promote the ones that you feel are both most beneficial, right?
So we don't necessarily promote any one.
Okay, gotcha.
It is very much an individual conversation, because your prescriptions come into play, your doctors come into play, your choice of hospital and pharmacy come into play. And that's very specific to each person. We know that especially in Erie, Pennsylvania, where we've got 2 insurance companies that own 2 hospitals.
Right.
So networks are very important in our area.
Have you noticed any connection between what people have had, let's say, at work, and then wanting to kind of stay the course for Medicare? Does that come into play ever?
Yeah, a little bit. Let's get into a little bit more detail of the Medicare side of it.
Yeah.
But most comparable to your employer coverage while you're working is an Advantage plan. But you have 2 choices within Medicare.
Okay.
It's the Advantage plan or Part C, or it's called Supplement, or commonly referred to as Medigap. 2 choices. That's also very personal to the person.
Okay.
We ask a few different questions like, do you travel? And that's like into the country and just all over the country because that can come into play.
Right.
What can you afford cost-wise? So many things.
There's
you
so
have
many.
no idea.
It's like a full questionnaire, I imagine.
I have a
out.
whole track I have to follow to make sure
Wow.
I'm on the up and up of it, doing what is best for them as the client. It does not matter what I want to do. It matters what they want to do and what matters to them. A great example of that is kind of all these carriers have extra goodies. Everybody gets stuck on the extra goodies, and they are lovely. We love them. I want to keep them around for everybody, but we can't make just the decision off the extra goodies.
Okay, yeah, you got to whatever
We got
the
to
main
make sure it's
the
going
main
to keep
coverage
the cost
yeah.
down for you.
Well, timing is everything, and right now we're in annual enrollment, right?
Correct. AEP.
Can you explain what that is? What AEP, right?
Yep. So you are 100% correct. It's the annual enrollment period, commonly referred to as AEP. A lot of the times we'll shorten it because that's a mouthful.
Yeah, right.
But annual enrollment period happens every year from October 15th through December 7th. That is every year as
today.
well. Today is the day.
Oh my gosh! Did you guys have balloons and cupcakes today or something? Or no, not
No,
necessarily.
we got right down to work.
You got right down to work. Yeah. That's amazing that you came on the day.
Well, I kind of I pushed the boys out and said, "It's our start to the day. Can we have this line?"
But it's not that very long. It's
No.
like what, 6-7 weeks?
It's like a month and a half.
Yeah.
Yeah. So this is that time of year where everybody can review your policies. Make sure that they fit you going into the next year. Have your prescriptions changed? Has your medical just changed in the past year? Have you had anything go on? Have you been diagnosed with cancer?
Wow.
That's going to change your coverage and what you want covered, how often you see the doctor. It's no different than a female getting pregnant. You're going to see more doctors in a year due to you being pregnant and want to take care of that. It's no different. We want to make sure any changes you've had in the year, that it still works in the same next year, because your plan can change from year to year. Sometimes they're minor changes, sometimes they're big changes. Depends on what we're seeing from the government and how carriers respond to it.
But yeah, Sadie, I think when we were meeting, you were saying that, that contact, that personal contact, whether it's an email, phone call, whatever, has to happen with every client every year.
It should happen.
It should happen.
Absolutely.
So if you're not hearing from your agent, find out why not, right?
Or find a new one.
or find a new one, yeah.
Find a new one.
They may not be doing it anymore.
Make sure that that you are having that you're going over your information. Is it mandatory? No. Is it a good idea? Absolutely. Because every year, just your health. What goes on? There's things that change. A great example is my mom. We put her in one plan, and then all of a sudden she had a medical condition, and that changed everything because she went from 0 prescriptions to 5 when she left the hospital.
Wow.
So things like that absolutely change what your coverage should be. And if you're not asking, you maybe have the wrong coverage, or maybe you just need to make a few little tweaks to it, which is why we go through the training that we do to be able to answer those questions for you.
And things that people should look into that could change from year to year would be like their premiums, or how much the drugs would cost, or what the network rules are, right, for your provider.
Year to year, that coverage, anything in that plan, technically coverage-wise, could change. So your specialist visit could maybe go from $25 copay, if you have copays, because that's subject to plans as well.
Sure.
But could go from a $25 copay to a $45. That's a difference you're going to want to know. So even in your own plans, just knowing what 2025 looks like, and then looking at 2026, okay, does that plan still fit me? Do I still like it? Has anything changed for the worse on it? What's changed for the better on it? Or just what's changed with me? It's not necessarily just the person. Plans change as well.
If I drag my feet, and again, we're talking to Emily and Sadie from their licensed Medicare agents with Hilling-Pfeffer Insurance Agency. If I drag my feet and it's like December 6th, if it goes to December 8th,
You have till midnight December 7th.
that's it, huh?
Otherwise, we're looking for some sort of special enrollment period for you.
Okay, so you can't make any changes after the 7th, basically. Potentially, yeah.
It opens special enrollment. Of course, there are special circumstances to everything.
Right.
But generally, yes, December
Okay.
7th is our last day.
All right, so why does it matter?
Because the cost of everything is going up nowadays. why not take a good hard look at what you have insurance-wise, especially health insurance? Make sure that we've got your copays manageable, that your prescriptions are manageable costs for you, as well as just the premium. There are some $0 a month plans. There are some $100 a month plans. Where do you fit on that scale?
What does a $0 a month necessarily cover, though?
It covers a lot more than you think. It's a very good plan. I have quite a few different people on those. That actually generally fits.
Is that needs-based or?
Not necessarily.
Okay.
You find those more on the Advantage plans, not to get into too much detail on them.
Right.
But they're most like employer coverage.
Okay. And if it does auto-renew, you let the 7th go past, it may not really be in your best interest, right? I mean...
Not necessarily. It could do nothing for you. If you're somebody who's coming hell or high water going to the hospital type of person or seeing a doctor, it may not mean a whole lot for you. Or if you had a big change in the year, it could mean you're paying a lot more out of pocket than you ever should be.
I want to go over common misunderstandings because people think that it, like it's the old, high option where everything was covered. That's not insurance anymore. I mean, anybody who's been around for 20 years knows that, right?
Mm-hmm. Yeah, it's not that anymore.
Yeah. Talk about some of the misconceptions there.
Well, people often think that Medicare is Medicare and that Medicare is the plan. Medicare is just the name that we give the enrollment. I don't even know what to call it. It's just for folks 65 plus.
I mean, there is some money coming from the federal government to cover this, right?
Absolutely. And you also pay into it whether or not you have a $0 a month plan or not, depending upon your income. You pay for your original Medicare, your Part A and B. But a lot of people think that Medicare covers everything, but it doesn't necessarily. You've got your health plan. That's generally you're going to get that. But then you got to think about dental, hearing, vision. Those come into a play a lot more, I've seen, as we get older, because of course we take care of it and do the general well checks and going on, but where do we see that decline in that? Where do we see people needing dentures and whatnot? It's not something that is well covered with Medicare.
What is the difference between like a Medicare Advantage or like a Medicare supplement? I always get confused by this.
There are quite a few differences in there. Plan premium is going to be one. Supplements can be a little bit more expensive than Advantage plans. Again, kind of changes depending upon what level you go into there.
Well, what's like the definition of an Advantage plan? Is that like a group? Is it multiple things versus supplements or?
So they're a type of plan, I guess is the best way to explain that. You've got Advantage plans and supplement plans.
All right.
Those are the two big ones with Medicare. They do have other names, so if anybody's listening and confused, you are not the only one.
Right.
It is a lovely topic. But you've got those two choices. So you kind of choose from there. Advantage plans usually come with lower premiums. They usually come with some dental, hearing, vision coverage in there, as well as prescription coverage. Networks generally matter on Advantage plans. Supplement plans, you don't necessarily have a copay. Your network doesn't matter as much. You can go across the country. So if you were somebody who's got grandkids in Ohio, California, and Nevada, you're probably going to lean more towards a supplement because you're going to be with your grandkids, right?
Yeah.
Unless you're not, or you're a snowbird. That's a perfect example of it. Supplements generally do not come with dental, hearing, vision, or prescription coverage. So you'll have to get another plan with those. But it truly is a very independent, personal conversation because so many things apply. Do you have a bad family history you're worried about? Are you thinking about dentures?
Yeah, wow.
What can you afford? Truly.
So we get a lot of TV commercials and mailers and everything this time of year, right? Inundated, right? Tell me the advantage of calling you guys at Hilling-Pfeffer versus just calling one of those 800 numbers,
Well, I think...
You get you guys, right? I mean, personal service, right?
In the wise words of Mr. Rogers, why wouldn't you want to be with your neighbor?
Right.
It's a company I'd worked with more recently, so I had to throw that in there. But truly, we are local Erie people, graduated from Northeast and Mercyhurst myself. We've got our office up on Street 3405, not too far from the news station. Why wouldn't you want to reach out to somebody who's willing to help you and at least help you understand? If you come in for a talk, $0, you owe us nothing just to discuss your plans and ask for help. We get paid by the carriers if and when you choose to go with a carrier. It's as simple as that. I know it almost seems disingenuous how much we care about other people, but truly, we've seen it happen with our family. We want to make sure that everybody's taken care of.
And you have access to, if somebody wants the Cadillac version, you can sell them. Or if they want to go super, super low cost because they're on limited income, you could sell that too, right?
Absolutely.
I mean,
So
but you're trying to fit it with the reality of their life.
Absolutely. Every year we have to contract with individual carriers. And so we have access to everything that's open in your zip code. And if not, we can get contracted in it. Something very willing to work with and when dealing with everybody.
There's some very unique groups that come in. So veterans are very specialized. Your teachers, your Pennsylvania employees. So there are different things, and those people need to be, they need somebody that knows what they're talking about to go over their plans, because they're very, very unique. And then there's
or to not go over their plans. Well, no, because some teachers, I have like that red stop sign, like hold up. This is a pause and proceed with caution type of person.
Wow.
Absolutely.
Yeah.
We don't want to make a mistake. That's my worst nightmare, is getting somebody coverage and them not working the way they expect it to. Worst nightmare.
You guys work with all the kind of the brand name carriers that are common around here. You have access to all those products, right?
Absolutely.
So, I mean, that's you're not limited to just one company.
No.
As if you were representing.
We are contracted
you're independent.
with 6 different carriers.
Okay.
And I think with 6 different carriers, don't quote me on this, everybody, it gets you 75 different plans.
Wow.
It's a lot.
So it's a lot more than you think.
Yeah. How about that new person? 65 is, I can't drive 65, right? I mean, it's happening right now.
Yeah.
Talk about some of that how you work with those folks,
So that is your IEP, your initial enrollment period.
Okay.
I know, throwing out all the terms.
We got a letter for that, too.
Medicare has a letter for just about anything.
Yeah, I bet.
And everything. But if you're turning 65, so your 65th birthday is a big one for Medicare purposes. So the first question is, are you still working? Or do you plan on still working? Because if you've got employer coverage, you're liking how it works and whatnot, you don't need to do anything other than delay your original, because you're not going to pick up Medicare until you're
Don't
retired.
You have to tell them, though, that you exist?
Yes.
Okay.
You're going to have to call into Social Security, say, I'm delaying it.
Okay.
You will get letters.
And you can help with that?
So we don't have as much help with that, but we can assist more.
Okay, good.
It's more of, I call it a little bit of hand-holding. It's a 3-way phone call because they have to approve it themselves, verify who they are. Right. And so I'm happy to help and sit through that and guide you with phrases to use and whatnot. Well, sometimes it matters.
Right.
But most of the time you have to do that one on your own.
Yep.
But then, so if you are retiring or you are not offered employer coverage at that point, you have basically 6 months surrounding your birthday, 3 months before, 3 months after, to sign up for Medicare. Generally, that will start effective the first of your birth month. I say generally because there's always exceptions. But then it's never too early to start looking at Medicare. I know it kind of seems that way, but time seems to fly. And then 3 months are gone and we're rushing to find you that plan. But generally, your 65th birthday, 3 months before, 3 months after, we want to get you signed up. And then if you are one of those, I don't know if it's unlucky people, but if you have an October, November, December birthday, you have 2 enrollment periods in 1 year.
Wow.
Very close together, because you've got your IEP, your initial, and then you have the annual open enrollment. You do still want to sit through both.
Yeah.
What's going to change might be more minor comparatively to somebody who's been on a plan for a year, but you still want to take a glance just to be safe.
Well, now is the time. Talk about how folks should get a hold of you folks at Hilling-Pfeffer.
Well, you should be able to find us on any some billboards around town. Those are new. It's very fun for shy people to have your face plastered on a billboard. But you can get a hold of us at 814-455-7611. That is our office number for our State Street location. That address was 3405 State Street. Give us a call. We can set up an appointment. You can come in person. We can do it over the phone. We can come to you, whatever's convenient.
Website?
We have the Hilling-Pfeffer website.
Okay.
That I am totally blanking on. Alan, don't.
Yeah. I think
Hopefully
it
he doesn't
is,
hold that against me. I think it's Hilling-Pfeffer. I want to say it's the name.com.
Yeah. We'll put it
Terrible.
put it on the comments there. Well, ladies, thank you so much for and I'm looking forward to this conversation every month. With the folks from Hilling-Pfeffer, and again, this brings a lot of anxiety to people in their senior years. Yes. Your job is to calm people down, simmer down now.
Absolutely.
Right?
I'm here to help take care of you.
There you go.
I'm part of the family now, basically.
Exactly. Starting at 64 and a half, that's when we want to start, that's when, that way it's not too much of an anxiety for them to be able to start looking at things. They will be getting things in the mail, and then that starts from there. And then from that point, after that, it's like every year, right before the holidays. They can come visit us. We can help make sure everything's good and go from there.
And bring cupcakes and balloons on the 15th.
If they want cupcakes and balloons, sorry.
Emily Williams, Sadie Prescott, licensed Medicare agents with Hilling-Pfeffer Insurance Agency. Thank you so much for taking the time.
Thank you so much for having us.
You got it. It's 5 minutes in front of 4.